I'm Julie Pace for the Associated Press on the North Lawn of the White House. President Barack Obama is getting ready for a major address to Congress tonight on healthcare reform. And I'm joined by Linda Douglas, the White House Communications Director for healthcare reform. And Linda, we hear that the president is still writing this speech, but what do we expect his message tonight to be?
Well, I think what you're going to hear from the president tonight is going to be, okay, we're at a point now where we have built 4 out of 5 bills on the president's principles of lowering costs, making sure everyone can have affordable coverage, making sure you can keep your choice of doctors and plans, getting rid of unfair insurance rules. Now is the time to move forward and enact the legislation. So he will explain what the stakes are and how we get to the end point.
How detailed is he going to be? Are we going to be able to get to the end of this speech and have a bullet point list of what the president wants to see from a bill?
Well, it will be very clear to anybody who hears this speech tonight how the president wants to get to the final product of health reform that does lower costs and protect Americans from unfair insurance practices.
Now, what about public option? We've heard a couple of different things. Obviously, the president believes that public option will increase choice and competition. Are we going to hear him say that he wants a public option in a bill, or is he going to keep that off the table?
Well, you know, the president has said repeatedly that he believes that putting a public option in the insurance exchange, which again is only available for those people who don't have health insurance or who don't work for a big company. Most people do and get their insurance from work, but for those who don't, there would be a marketplace in which there would be a public option to help lower prices and make more affordable choices available. He said that as recently as Monday. So the president has said that consistently, and he's likely to talk about it again tonight.
But are we going to hear him go a step further and say that he wants to see that in a bill?
Well, the president has always said that he thinks it's a very, very valuable tool for achieving those goals, and you'll certainly hear him talk about that again tonight.
And now, one of the big questions is who exactly is the president speaking to? Is this a speech that he's going to be speaking across both sides of the aisle, or is he at a point where he feels that Democrats are really who he needs in his corner if we're going to get anything passed?
Well, the president is going to be speaking first and foremost to the American people. They've heard a lot of confusing things about what health reform is and is not. He's going to clear up some of that confusion tonight for them. He's going to let them know that he understands what the stakes are for them in their lives. And of course, he's going to be speaking to members of both political parties who, by the way, at the end of this August, Democrat and Republican realize after talking to their constituents that doing nothing is not an option.
We're actually hearing the president right now. He's departing from the lawn of the White House heading to New York. Finally, you deal in communications. The president has been out there speaking about healthcare reform since the campaign. What has he learned from how he approached the message on healthcare? What has he learned that he might do differently in this speech tonight?
Well, you know, I think the president has communicated very clearly, consistently from the beginning, what is at stake for people. They've got to have lower costs. They've got to be protected from unfair insurance regulations. They've got to have security and stability in the insurance market. 1 out of 3 people over a 2-year period went without insurance at some point. That's a very big number. So he understands that the stakes are very high, but he also understands that the special interests who have consistently, decade after decade, tried to block reform, are trying to do so again. And the important thing now is to let the American people know that we're listening to them and not the special interests.
Does he see this speech as a continuation of his message or a pivot point in this debate?
Well, it's a new phase. The bills have been written, there's been a process underway in Congress. Now is time to take the pieces of those bills, pull them together, put them into final legislation that'll start providing relief for the country.
Okay, Linda Douglas, White House Communications Director for Health Reform. And a reminder that the Associated Press will be streaming President Barack Obama's speech live tonight. That's 8 p.m. Eastern Time. I'm Julie Pace at the White House.